We hope you enjoyed the first half of the Learning Lab and that it was somewhat useful to put common language and conceptual frameworks to a lot of the work, as one of the groups said, that people are already doing without even calling it implementation science. So that was lovely. So we got a general sense this morning of the geographic spread of the participants in the room, and we realized that it might be interesting to know a little bit more about you. So I'll tell you the two questions we're going to ask so that you can prepare for when to raise your hand. We're interested in the room for you to tell us if you usually work more in or have a background in agriculture versus nutrition versus health systems. So if you can categorize yourself into one of those, maybe challenging for some people, but you can try. And then the second categorization, which Ed is not a fan of, but I would find very interesting, is who identifies more as being a researcher, maybe with an academic background or from a research institute, versus who identifies more as an implementer of policies or programmers or programs. So those are the two questions we'd like to get a better sense of who's in the room to help us in the way that we go about presenting the case studies. So first question, we're gonna have ag, nutrition, health as the option. So agriculture people, could you please raise your hand? Okay, about 8 or 9. Nutrition. Wow. Okay, too many to count. Health systems, health services. Okay, also around 8 to 10. Thank you, super helpful. Now we're gonna go for Ed's favorite divide, the programmers and the researchers. So who works with an NGO or implements policies and programs? 4, 5, 6, 7, 8, 9, 10, 11, 12. About 12, we'll count you. We're glad you joined us. How about research, academia? Okay. It's about 1/3, 2/3. Great, thank you so much. I think we're gonna start with Rashmi's presentation, case study from India.
Good afternoon, everyone. This is a post-lunch session is always difficult, but I'm glad I'm going to catch you before the slump hits. So I'm going to talk about a case study here, which is under a larger portfolio of program that we do in India. It's called Poshan, not to be confused with the Poshan Abhiyan, which is the National Nutrition Mission in India. It's a large umbrella program under which one of the evaluations that we have done is now I'll be presenting as a case study. So just to give a brief overview of what we do in Poshan, it's a program where we mainly work to support data-driven policy and programmatic engagement at the national and state level. And we do this through multiple approaches. We do evidence synthesis, evidence generation, and knowledge mobilization. Under those three principal areas, we bring together evidence to for improving program implementation and policies. There are three main work streams under Poshan. The first work stream is around supporting state-level learning. And across these work streams, implementation research is a core for Poshan itself. And you'll see that as I give you some examples around the three work streams. Under the first work stream, which is to support state-level learnings, we generate evidence for states taking a retrospective look of examining nutrition outcomes of how states have improved, what were the determinants, what were the policies, programs, how did the states go about the changes and how they improved. And we bring that to the states. The other part of it is we use data and evidence to support policies through generating program-oriented data analytics and products. For example, we bring together something what we call coverage data notes. We use nationally representative, publicly available data, similar to DHS. Here in India, we call that National Family Health Survey. We use that to generate data analytics around coverage of interventions. interventions, maternal and child nutrition interventions for different states and for at the national level also. So that will show where a particular state is, and it can compare itself to the different states as well as to the national averages. Then we use these products to generate awareness and data-driven decision making. For example, we also bring together something called district nutrition profiles. We use this to engage with bureaucrats, policymakers, to show them what can be looked at, how data can be used to inform their decision making, but particularly in the implementation realm of it. And we are also, within the program, we are opportunistic and responsive. For example, we work with state governments. If the state government asks us to do some research around an topic of interest, which is relevant to improving the program, then we take that up. But at the same time, we also generate new knowledge and bring that to the state to show them what can be learned more around the programming within the state. And process evaluations are another set of evaluations that we undertake as embedded in impact evaluations, but within this portion portfolio of work to inform programming. And just to close out on portion itself, we use several methods. I think one thing we didn't talk about in the morning is there are several methods one can use in implementation science. And they can range from landscape reviews, which could be desk reviews of policies, programs, and we could include primary data collection or use secondary data to generate data products, qualitative research methods, quant research methods, and when there are solution-based approaches, we could even use experimental designs to implement and identify which solutions work better in given settings. And all this actually falls under the big bucket of implementation research methods. So as I move on with the case study itself, we have set this up to answer 4 questions. One is, what led to the realization that there was a need to know more about the implementation? And this I'll talk in the context of the example of the Integrated Child Development Services Program. Since several of you are not from India, I'll just give a brief description of the program. This is a nutrition flagship program in India. It has been running for more than 40 years. It has in each village around 400 to 800 population. There are centers where the frontline workers deliver services related to health and nutrition. So in 2016, the government of India actually started to pilot a program. It was a multi-component program which is giving to the frontline workers a phone app. They gave them the mobile Android phones with a mobile app in there, because the frontline workers actually they used to have 11 registers, which is the MIS system for these frontline workers. They have these 11 registers that they have to maintain, whether it is looking at their services. They have a home visit register. They have a food supplementation register, household survey register to know who and all are in the village. So they have 11 registers. So what the app did is it digitized that into an app. So now the frontline workers could use this to track their services. So the program itself has 3 components. One is the app for the frontline worker. There is another app for her supervisor. And then there is a dashboard for the supervisors up above who can actually see how the delivery of the services is taking place. So this being a multi-component program and in a big flagship program, there was impact evaluation was commissioned, and there were several other components to it. Well, the impact evaluation was set up to assess impacts of this CAS application over and above the standard systems of delivery. And then there was a cost analysis, there was a technology analysis, and a mixed methods process evaluation. There were more than 10 implementation partners, the government being the main partner, and then there were more than 5 evaluation partners themselves. So IFPRI was one of the evaluation partner. There were multiple reasons that led to the investment in the implementation research itself. Because this was a government program and it was intended to be a pilot program to test how this works. And everyone was working closely with the national and the state governments to get this program rolled out. And when we started the impact evaluation and when we shared the baseline results, then the government said, okay, that's great, this is the baseline, but we want to know how the program is working on the ground. Well, is the training working? Are the frontline workers happy? What is going on? That's what we want. So there was a demand from the government. And since it started as a pilot program, there was a huge, within the system, need to learn about how this is working as a pilot, what are the things that one need to be cognizant of as it gets scaled up. And then because the impact evaluation itself was set up as within 1 year time frame, we needed good information around the implementation to be able to document the pathways and to explain what we find in the impact evaluation itself. So different reasons added up for us to invest in process evaluation. So how did we go about getting what we needed about implementation? It was an iterative process. To identify the research questions, first we need to know what the program is, how it is being implemented, what does the program look like. So the whole process was in collaboration with the multiple implementing partners. There were several meetings held. A program impact pathway was developed, which lists the steps on what are the expected pathways for the program to follow so that it reaches the intended beneficiaries. And because there is a technological component, there is a training component, and then the frontline worker actually being able to use it, there are the platforms set up, are the processes there, and what is at the utilization level. So program impact pathways were developed. Then we had gone back and forth to identify what are the questions that we are interested to learn. What are the meaningful questions to ask? And then we identified 3 questions. How do upstream and contextual factors and processes affect the rollout of the ICDS CAS intervention to the ICDS frontline workers? When we say upstream factors and contextual factors, that means that what are the processes, whether we think of the hiring of personnel, procurement of the devices, the training, how did different partners come together even to start the implementation or thinking about the intervention. Those are the implementation platforms. Then we said, how do midstream and contextual factors affect the use of the ICDS CAS? Here we are thinking about the frontline workers themselves and their supervisors. What motivates them? Do they have the knowledge? Are they able to use this technology? And then when they use it, is it working? And then finally, how do client populations feel services have changed for them? Because the ultimate goal is to improve the service delivery. So what is the perception of the client population? So once we identified the questions, then we mapped the methods to each of these questions. To answer each of these questions, what are the methods that we need? We didn't go with the methods lens and then look at the questions. So to understand the upstream and contextual factors, we said we need to do in-depth qualitative interviews with at the national level, at the state level, with the stakeholders. There were multiple stakeholders. There was the government, World Bank was the donor, BMGF was funding, CARE was involved. There were so many big implementation players. So we needed to understand from each of their perspective what they thought was working, how did they go about setting up the intervention. Then when we looked at the midstream and contextual factors, we needed to understand within the given states, because we conducted this particular evaluation in 2 states, in Madhya Pradesh and Bihar. So in these 2 states, how are the frontline workers perceptions, what are their challenges, what does their in general knowledge look like in terms of service delivery, and how are their knowledge is with the application itself, and what are the challenges. So for this, we commissioned surveys. We took more quantitative approach with embedded some qual questions. It wasn't a qual survey. And then how do client populations feel services have changed since introduction? We did a household survey to understand perceptions of the client population. This is just an example of what a program impact pathway looks. I know there are lots of boxes and arrows that are going quite a few places, not to read this, but just to say that the green boxes are those that are relate to hiring process. The yellow boxes are around what the training components, and the blue talks about the device and data management. So each component was fleshed out to say what is the sequence, and then we also have included the time frame. How much time frame would one think each component, each box would take? We have two other program impact pathways to look at the processes of how the Anganwadi workers are using the delivery, and then there is a supervision pathway itself. So it's just an example. And then once we identified our research questions and the data collection methods, we had to start our process of data collection. But this was always an iterative process. Typically, when we do process evaluations, it's one time within an impact evaluation time frame. Somewhere in the middle, after the program starts kind of settling down, maybe 6 to 8 months after a program starts. However, in this case, we were flexible. We wanted to see how the program is progressing, and we were doing this in collaboration with so many implementation partners. So always we would develop the tools, share with partners, get their inputs, go back, implement the data collection, share the results, and then tweak again for the next iteration. So if we look at, we temporally sequenced it. For example, we started with observations of the training. The first critical part is the training of the frontline workers, training of the trainers. So we started with that. And when we went back and presented the findings on the baseline, as I had mentioned earlier, and we said we'll do the observations, and later towards the end of the year, we'll do a field survey to understand what the frontline workers are, how the implementation is on the ground. But in between, we finished the baseline. We went to the government. We shared the baseline findings. They said, no, we can't wait till the end of the year for you to tell us how the implementation is going on. You need to tell us now. So then we said, okay, we cannot get up and start a field survey right now, but what is another way? So we said, okay, let's use phone survey. This was the first time we tried phone survey. And because now all the frontline workers had phones, we had the phone numbers, so we could actually do a phone survey. And we, again, took the results back to them, and then we did a field survey, full-fledged field survey, end of 2017 and 2018. And at the same time, there was a technology and usability assessment that was going on, and then there was some other qualitative work also was going on. So I'm not saying that all these components were not done by us, but it was a team of researchers that we were all doing this. And then after the field survey was done, the field survey was done in 25% sample of the total impact evaluation. So when we shared the findings back to the implementers, they said, well, this is a snapshot. What is happening in your full sample where you have the impact evaluation? Okay, so now go back and do a phone survey. So that's how we ended up doing another phone survey, which actually with a 1-year gap. And this actually built on what we learned from the field survey. And then when we were doing all this, not all program components have been rolled out. For example, I had mentioned that we have mobile app at the frontline worker level. There is a supervisor app and a dashboard. So when we were in the field, the dashboard was not ready. So now, in a couple of weeks, we are going back to look at how the dashboard is being used and how functional it is. So basically, it has been a very dynamic process evaluation, learning and feeding back to the program. I just want to give a snapshot of the results because it will take complete 2 hours to just give the entire results set. In a snapshot, frontline workers find it very easy to use the app. We have these findings from Madhya Pradesh and Bihar. Orange bars are Madhya Pradesh and blue is Bihar. So these are the different modules as part of the app, and a majority of the frontline workers find it easy to use those modules. And of course, there are challenges. There are quite a few challenges that the frontline workers face, and this is related to the internet being slow, limited or no network coverage in their area. They submit the data, but somehow it's not getting uploaded. So their supervisor is calling them and saying, hey, you didn't submit the data, but they have submitted. So and then suddenly the app stops, battery dies, or the mobile is heating up. I mean, these are some real challenges, and even we face with our mobiles, right? So this is and what we see is right now, if you look at the prevalence of the challenges, it's around 50%. It's not too much. But when we did our first phone survey, it was over 80%. As the year progressed, the challenges also have come down. So another challenge that was the frontline workers were facing, and this we came to know through, again, multiple different types of data analytics, is the heuristics and usability study and the qualitative interviews shed light on that. This is one, on the left side, the picture that you see is one of the app features. That's a home visit scheduler that tells frontline worker when she should go and visit the pregnant women or a household with a child. And what the findings showed was that the frontline workers were getting confused with so many symbols, colors, and written messages. So they couldn't quite fathom what each of this was supposed to do. And similarly, growth monitoring is one of the key features of the ICDS. The growth monitoring app as well had issues with the frontline workers not being able to navigate that effectively. So overall, nearly all frontline workers reported one or the other challenge. And through our interviews with the high level, at the national level, at the state level, stakeholders, what we found is, although it's a national program that got implemented through the states, there was a sense at the state level that the center needs to engage with them better while designing the program, and the states felt that they need to have the ownership of the program, and their investment in staff capacity at the state level is very much needed. And here is where we were talking about earlier, what does it mean by context in implementation research? The states vary in how they implement programs because there are different capabilities within states. And that context needs to be taken into account when we design programs, or need to focus on those specific contextual elements that need to be strengthened when one particular program is being scaled up through the system. And then the overarching thing is, this is one intervention that is part of an overarching program, which is the ICDS program. So an app is not going to change the design of the program. So it's going to facilitate implementation. It's not going to change how the program itself functions. So that has to be, one has to be cognizant that it is embedded within the system itself. So how did the new knowledge get used? We have generated all these learnings. What happened? So we shared the findings with the partners, with government, and at the national level and the state level. Implementers discussed the findings. Some actually went back to the field to recheck what we were saying, and pleasantly they were surprised that they also found similar findings. And then we use these findings to inform development of high-level briefs that were shared at the ministerial level, at the high-level donor meetings, and at the state and with different states as well. We continuously presented these findings. And what was gained by using the new knowledge? So we generated this new knowledge. What was gained? So it was less than perfect, but there was a beginning. For example, the app design itself, the features were revisited. So, for example, the growth monitoring module and the home visit module was being re-looked at by the developers of the program. And then the internet connectivity issues that came up over and again, efforts were being put in place to deal with that as the program was being scaled up, to identify local network providers rather than who is at the state level, but to look at within blocks who is available so that the connectivity issues can be addressed. And of course, gaps do exist. We did talk about how looking at how to replace phones and what is the next plan. If once a phone is used for 2 to 3 years, it needs to be replaced. So what are the plans in the system? So those kind of things are still need to be strengthened. That's something the policymakers have to take into account, but something has started to move. What I personally learned from this particular process evaluation is designing research, engaging partners, and sharing findings is an iterative process. We have to be persistent, persuasive, and it has to be a collaborative effort. We have to be flexible in what needs to get done. And it's time and resource intense. It takes time. And of course, we were really happy to have resources that we could do this, but it's not necessarily always the case that we have enough resources to do such extended evaluations. Thank you. So I understand that we'll take questions at the end of second presentation.
Thanks, Rashmi. So I think we hope the two presentations will be complementary, because one is talking about how you can influence policy and programs within the government. And the presentation I'm going to give is more about one specific NGO project and how to embed implementation science into a program. Both of our examples are from South Asia, so bear with us on that. This presentation is about Swahara, and we're a multi-sectoral program. We work in 8 sectors, so we don't have time to go through everything that we do, and we just chose one indicator to explain to you what the implementation science cycle has been for this particular indicator, but the process we use for other behaviors, including WASH, and so on. So we're gonna focus on egg consumption, because it's a big priority for a lot of us working in the ag nutrition space. So if you haven't heard of Swahara, we are in Swahara 2 right now. It's a USAID-funded multi-sectoral program intended to support the government of Nepal's multi-sectoral nutrition plan, moving from a plan to actually action in communities. And we have a target that in 5 years, we should reach 1.5 million women and children. You can see in yellow, those are the geographic areas we cover. So it is at scale. It is not scaling up. We are in 3,353 wards or villages of the country, and that's half of the ones that exist. So our results, we're aiming to improve the nutritional status of women and children in the 1,000-day period with typical impact requirements of reducing stunting, wasting, underweight, and undernutrition of women, including anemia. And we are tasked with doing that by improving household level behaviors, but also systems in agriculture and health that support an enabling environment for those behaviors. Okay, so the animation is gone, which means the slide is covered, which isn't good. But I'll summarize. There was a massive computer meltdown this morning. Apologies for this. So we have rescued a PowerPoint slightly unsuccessfully, it seems. Basically, there was an initial 5 years of intervention called Swahara, which was also USAID funded. It was a consortium in Nepal. And we realized at the end of Swahara 1 that there was still poor dietary diversity, basically, and that egg consumption and other animal source foods, which we know are difficult behaviors to change, persisted. And so there was a round of formative research that went into trying to understand what the obstacles were to improving these behaviors, and with a focus on why is egg consumption not improving, particularly among children? And there was a variety of exercises done, some regression analysis, modeling done just within quantitative monitoring surveys, so not a separate trial, not a separate evaluation, just using the quantitative monitoring data that we have to try to see if we could look at determinants of which types of people are and are not eating eggs, as well as some qualitative formative research, and as well as what we've talked about earlier, trying to document the tacit knowledge that the field staff had about why people were and were not eating certain types of foods. And of course, we learned from that although you might have an SBC intervention that encourages people to eat eggs, there are barriers beyond knowledge. I think this is not surprising to anyone. There's an access and availability issue. There's a cost issue. The program was designed and the villages were chosen precisely because they are poor, remote communities. So there's an issue of poverty. And there's also issues around chickens dying and poultry disease and other things that affect the ability to produce eggs and consume them. So this is how we realized that we needed to know more, and this is some of the things that we did to understand more what the problem was. And then the question is, what should we do about that? And this is really sad that the main text is covered up. So there were a few things that we did to address this. The first was that we decided in SWATA 2 to get rid of a focus on moms and babies and to switch to a whole family approach. So the idea is that if you're only targeting your SBC at one household decision maker and not all household decision makers, your influence on the household might be limited because there are other people who have decision-making power and control of income, and they should probably be involved from the beginning. Another bullet that is covered that the program did was we decided that we could no longer just work on the demand side. We also needed to work on the supply side. And so some effort has gone into developing public-private partnerships and trying to have stronger linkages with the government systems that allow for extension services. So these are things like improving veterinary extension services, improving feed availability in the market, improving collection centers so that people can bring the different agricultural products together. So the idea was, and this is a couple of years ago, the idea was, okay, at the end of 5 years of programming, we learned that there are all these other gaps. So what are we going to do in the second phase, the second 5 years that tries to address beyond knowledge? So those are some of the examples. SWATA 1 also focused on getting, for those of you who know Helen Keller's work anywhere in the world, we mostly work on a homestead food production model where you encourage households to grow nutrient-dense vegetables and fruits and also to raise poultry. And the outcome of this is intended, they call it the garden-to-plate model. So if you produce in the household, you have greater access and availability and you can eat those foods that you produce. But in SWATA 2, we have tried to extend this pathway, especially for village model farmers or households that seem to be doing a good job, and move them from garden to plate to market and allow them to have an income generating opportunity with the conceptual framework or the theory of change in mind that if people have more money, along with more eggs or nutrient-dense fruits and vegetables, they can also spend that money on things that help them have better health and nutrition. So we continue with the problem, but bear with us. So we also updated our social behavior change approach, and I guess it's first important, and you can see them here. These are the three behavior change models that have existed since SWATA 1, and I think are pretty standard across a lot of the programs that people in the room work on or do research on. So the first is we have interpersonal communication. These are home visits where somebody that you hire in the field, for us it's nearly 2,000 people across the country, who are going door to door and providing counseling on IYCF, WASH, and other behaviors that we would like to promote. We also have community mobilization. These are group meetings, so this might be your standard Health Mothers group meeting. We also have an activity that we call Key Life Event, where we get the community to celebrate a new pregnancy, a new baby, or a child turning 6 months of age, and the members of the Health Mothers group make a basket with soap, eggs, greens, locally available micronutrient-rich foods to try to celebrate this important event. And then, as you can see, there's a radio. That's because there's a radio program that we air on a weekly basis on about 200 stations throughout the country. And I liked the questions about context earlier. We have this radio program currently being aired in 3 languages across 200 FM stations And we still hear feedback that there are about 300 more languages. And there's bandwidth, obviously, for time to produce them and language translation and things like that. So anyway, this is called Banchanama and really is intended to allow greater spread of information. These activities existed in Swahara 1. And if you remember, what I'm trying to explain is what we did at the end of Swahara 1 to design Swahara 2, learning the lesson that behaviors didn't change. So as an example, in Swahara 2, the frontline workers were encouraged that when they go door to door, they should not be doing intensive counseling with mothers. They should be doing the intensive counseling with households. This is easier said than done. Many of our frontline workers did not start being frontline workers because Swahara came into existence in 2012. They've been around development for 20 to 30 years, and we've told them to talk to moms about babies. So this is a behavior change at the frontline worker level that also has to change. We also, in our mothers group meetings and other community events, realized that attendance was particularly low, so there was a need to make them more modern and innovative, and so we've developed new approaches, including videos. If anyone wants to know some of the approaches we use, I'm happy to talk about that. And then in our Banchanama, we changed our radio program. We added a bunch of characters. So there's an adolescent in the radio program. There's a mother-in-law who in South Asia is quite important. And there's a father in the picture in the radio program. So again, the whole idea was to try to address some of the barriers that are existing that are beyond knowledge. So, okay, this is good. There's no animation, but at least nothing is covered up, so we're making progress. This is the EHFP model, for those who don't know. So in addition to working on BCC to encourage people to adopt practices we want, we have some supply side intervention at the household level. So if you start at the bottom, if you can see that, basically households who are in this particular intervention, which is a little over 100,000 households at this point for us, they receive training on homestead food production, basic ideas about how to produce nutrient-dense vegetables and how to rear poultry, what the care for the poultry looks like, what feed is needed, et cetera. They also receive a one-time distribution of seasonal seeds, so 3 packets. Those seed packets also have to be contextualized. What grows in the mountains in Nepal does not grow in the Terai and the flat and the plains, so we have different seed packets that get given to different districts based on what's possible to grow, and they get 5 chicks with the idea of reproduction. There's, of course, a bunch of IEC and BCC materials, some that are used at the community level, some that are actually used at the household level. And then there's ongoing support, because in every community, there's someone identified as the village model farmer who creates a demonstration plot. They get 8 chicks rather than 5. They get some additional inputs, and they are responsible for mobilizing an HFP beneficiary group to continue to provide support to the household that's trying to engage in homestead food production. And then the blue boxes, other than the one, I just wanted people to have an idea of the scale of the program, because one thing I didn't say earlier was that while it is true that we are operational in all of the yellow areas in the map that I showed you, that's for our core programming. And there are additional program components such as HFP that we only give in food insecure or in needy communities. Kind of a lengthy discussion of how those were chosen. But this is the scale. So while we might be trying to reach 900,000 households to get to the 1.5 million people for the overall program, the HFP is a much smaller component that to date has reached about 115,000 thousand-day households. But we're also reaching village model farmers, who are the agricultural extension workers from the program, and FCHVs, female community health volunteers, which are the government's lowest level cadre of community health workers. So again, trying to get the health workers to understand the basics of why growing nutritious foods at the home could help address some of the health and nutrition problems that they do in their job. So it's a combination of integrated versus co-location. And the blue on this side is really the extension to the market that I was mentioning earlier. So the idea was that you have people who have done a really great job, and maybe they are ready to not only be a VMF for Swahara, but to be a local resource person identified and accredited by the government to be a poultry breeder or an expert on plum production. So we provide specialized trainings so that they can be local resource persons. We call them LRPs. Also savings and credit training, also business planning and marketing. So in other words, as the community evolves and becomes adapted to your program and the uptake is high among certain people, being able to build on that for the next phase is also quite important and requires implementation science, no doubt. So this is also some of the systems level engagement that happens. So it's not only a household and community level program, but there's a lot of engagement with the national and provincial level government. This is writing training manuals for in-service training, and also helping the government write their strategies and policies, particularly making sure that agricultural policies take smallholders into account, encouraging that there's investment by the government in the extension services, vaccination services, that feed is actually available, vaccines are available. Nepal is also recently decentralized, so we have newly elected governments with extreme variation in technical skill and managerial skill, so there's a lot of work that goes into building municipal and ward level knowledge and skills related to agriculture, and you can see some examples there. This is also for us really important for sustainability reasons. When the funding from the donors and the NGOs is not there, we need there to be linkage and government buy-in that these are important nutrition-sensitive interventions that they can put in their own work plans and their own budgets at a local level. And we're quite excited about our private sector engagement. These are mostly small scale, being done in 1 or 2 of our 42 districts. But as an example, we work with the Nepal Poultry Federation to help us have a massive nationwide egg campaign, just to get the messaging out there in a very different way. And that also is intended to stimulate markets in local communities to know that there will be demand coming. So it's attacking it from all angles. You can see at the top something that I was mentioning, that while we're in more than 3,000 wards, it's a little less than half of those where we actually do this intensive agricultural intervention. So these are some of the other data-driven program refinements that we've made. I think implementation science is the word we're using now. You can also talk about evidence-based programming. It's similar. Basically, we realized that we needed additional inputs. There are certain households, even within an area identified by the government as a disadvantaged area, there's variation in those households. And so the poorest of the poor is one way to think about it, and they might need an actual one-time donation of the materials to build the chicken coop, as opposed to just the technical knowledge of how to do it. We realized that greater follow-up than we initially envisioned was needed of our village model farmers, that a one-off training and then relying on them to be the village level frontline worker was insufficient, and the evidence and the knowledge coming back from our field workers was that this is insufficient and they need ongoing monitoring and coaching, and that really they need it to be linked to opportunities at the market level and for income. We've also learned that because we work in 42 districts, there's a lot of district level variation for cultural, agroecological, all sorts of reasons, and that we need the plans to be consistent enough across the 42 districts that we can tell a story and we can document our implementation, but that there's some flexibility for the district level staff to focus. In some areas, poultry production might be high. In other areas, there might be a problem with poultry production, so we need to adjust our plans. This blue box is covering up the original radio that you already saw, the Banchanama program, and this is to show you that your SBC can also evolve based on learnings. Our demographic data from our first monitoring survey showed that radio is not as popular as it was in our last survey in 2012, and that phone ownership and smartphone ownership was higher than we thought. It also showed us that half of our households don't live with a mother-in-law anymore. So lots of demographic realizations, and then we had to think, okay, are we still gonna try to reach people with this old method, or do we need to reach people where they are? So we have moved our Banchanama radio program on Facebook. You can hear all of the episodes on Facebook or on YouTube. The exciting thing about that is, again, with the whole family approach, Nepal has the highest rates of exit migration for labor in the world. The men who are living in Bahrain, Doha, etc., can also send in, rather than call in, they can also send in their questions to AMA through Facebook Messenger. So it's really keeping up with what the data is showing in all different dimensions. Similarly, we've started an SMS campaign given the phone ownership growth. So I hope, in a nutshell, I've tried to explain 7 years of, as Rashmi put it, it's an iterative process. It's not so linear. It's a lot of data, it's a lot of programming, and it's constantly going back and forth to make sure you're adjusting the programming based on the realities. Some of the results of this, so we don't yet have our impact evaluation done. We're using monitoring data. But what we can tell you is that we do see steady progress in reach of the intervention. This is a major issue for a lot of development impact evaluations, is that the program doesn't reach the population. So we're trying to overcome that. We also see that we're reaching new target audiences. So while fewer male household heads have been reached than mothers, the male household heads has also increased. Egg consumption seems to be increasing, and we're seeing a narrowing of the gap in these behaviors between the disadvantaged and the non-disadvantaged areas, and some government replication. So where do we go from here? What's next? Well, we still have a lot to learn and a lot to do. Egg consumption is still at around 10 to 12%, depending on which survey data we use. So for the next year 4, which is kicking off July 1 for us, we're investing in a national egg campaign. We've brought in people from the private sector to think from a different angle about how you actually get people to engage behaviors, and not just from a health and nutrition behavior science perspective. We also want to have greater focus on market linkages and more SBC on maternal diets, because we're seeing that the child diets can move a little bit faster than maternal diets, and we're trying to investigate that more. And then we have more implementation science questions that we want to answer, and I can give 2 examples. One, Ed sort of mentioned earlier, we're working with Ed and Andrea and a couple of students to look at, can you use SMS to motivate behavior change around diets? So can we encourage people to eat more eggs through SMS campaign? And then we're also interested in village model farmers and how to make this a more sustainable model. What makes some village model farmers drop out and some stay engaged, and some are engaged but at a basic level, and some are superstars? And can we try to look at the determinants of that? So, of course, now we're going to do an egg campaign. Now we're going to do SMS. That means we need new knowledge. So we went out and did another round of formative research. We tried to get deeper on the barriers so that our SMS campaign actually addressed the barriers. And I'm not going to go into all of that, but it's just to show that the cycle is never ending. Every time you want to do a new intervention, you need more formative research to guide that intervention. And then you need to follow that intervention with more science along the way to make sure implementation happens. This means that there are many challenges that I think a lot of the examples you gave earlier really point to. I think to assure quality of implementation, I was really excited with Ed's slide that could be an outcome in itself of some studies. It's a major, major challenge. Just like researchers are limited by resources, time, and money, the same is true for programmers. And how do we prioritize? We've chosen the model of putting myself into the program, into the NGO, and having a researcher there. There's other models where you contract it out. But how do you keep the knowledge flow going between the two to have ability to work within limitations? This requires when you have new findings, you have to adjust your work plans, your budgets, your staffing, et cetera. Sometimes that's allowed and sometimes it's not by your contracts from your donors. So I think I've already said this. It's a feedback loop. There are a few other lessons learned for us that might be applicable to some of you about evidence-based programming. One is that it's going to be very hard to get your results into programming if you didn't engage with the programmers. You could make the analogy to policymakers, I guess, Rashmi was doing at the very beginning. So our program team, our WASH team, helps us to design the WASH questions that go into the WASH questionnaire. Ag team, same thing. And then it's data that they own because they asked for it. So it makes a huge difference. Data workshops are really important to building skills. We need more program implementers to understand the basics of interpretation of graphs, charts, progress, lack of progress, association, causality, really fundamentals. I think if we don't get the programmers on the same page, there's huge gaps in communication between the two groups. And then it's funny, you would think we shared slides, but I mean, I really agree with the demand-driven, which was the 3rd bullet point this morning in Andrea's presentation. It has to be demand-driven. We need the programmers to know who the researchers are that are interested in this, and we need the programmers to be able to articulate to us exactly what science questions need answering so that the researchers can step in. These are all the people implementing Swahara. And thanks to all of them, we're here, and we hope that this example is useful and provides for some fruitful dialogue.
So we can take a couple of minutes for any questions for either Rasmi or Kenda. Anybody has?
I had, one question and one comment for Rashmi. The question was, you definitely talked about taking the data back to people at the national level, at the state level, and everybody. Did the data that you got, did it go back to the Anganwadi workers? Did you let them know, or did the system allow for it, that they know? They must have given you some time for your phone surveys and all of that. So did they know? And that is one. And then the comment was, it was also related earlier to Andrea's presentation, that sometimes people at the national level, when they're like rolling out these large programs, like we all know, that they can't wait for impact. They're very impatient. And they also have donors knocking at their door, or their highest, the prime minister asking the health minister, what is happening? Why do I continue to have to invest such money? Now, in a case study that we did in Ethiopia, we saw exactly this, where it was called the Program Delivery Unit, which would be the equivalent of the National Nutrition Mission in India, maybe. And there, the person who was heading the PDU, he told us, look at it like this. Our jobs are at stake. We need to show them that something is happening. So ask the questions. Come back to us and find out from us. It's very, very important. So, what I'm trying to say is, like, there are so many reasons why they want to know. It gets sometimes very passionate and emotional for them, and then they drive it. It almost comes down to that. So, sometimes trying to understand what is it that asks, that they demand an evaluation, or that they demand somebody to go and document the process, is not always very scientific, or is not always very, there's more reasons than we can even imagine. And there's just, something to say. But then it has other outcomes, of course, but it comes from a very different place. And we were very surprised that somebody sitting there could actually articulate this to us. We were outsiders, but they did. So.
Thank you for that question. We did not go back and talk to the Anganwadi workers and tell them, share the results. But as the program implementers heard about the results, and as we see that the challenges are being taken care of, I'm hoping that the issues are being taken care of on the ground. But you're right, we took their time, but I think that's one of the things we generally don't do, but should figure out how to do it.
This question to you, Dr. Rashmi. Regarding this mobile app, the problem is it's what's happening. Earlier, they had the registers. I don't want to be sound against the technology. The problem is they had the registers. So they are manually doing, they had the idea which child is in which condition. So now, like if they are growth monitored, or they are SAM, or they are MAM, like which condition they are, so they know very well. Now it's happening, since they are uploading in the mobile app, most of the cases, they are not maintaining the hard data. So they are forgetting also. So, because for them, the job has become, I just have to report. So that liability, the accountability is coming down. So they are thinking, okay, I just have to report, and I'm reporting. It's done. So when we are going for passive screening for SAM or MAM, or kind of stunting or vesting, so we are seeing that Anganwadi teacher, they are not able to tell very ready to hand which children is stunted or default. Such kind of things are happening. So I think in that monitoring system, if they are being involved with the feedback mechanism, it would be helpful. So that can be one challenging point for the implementation.
The idea is when they upload the data, it goes to the block level, and the lady supervisor has it in her app, and then the block level person has it as a dashboard.
Yes.
So there they get the information.
Yes.
Then the feedback has to happen. So again, like I was saying, one cannot change design of the program by introducing an app. in the ICDS system, has there been a culture of feedback mechanism? If that has not been there, then an app is not going to change that.
Exactly.
But it is the first step. Now, with the dashboard, now they are forced to see the data. What they are seeing, we don't know. And how they are acting, we don't know. But one of the important things is growth monitoring and weighing efficiency is one of the indicators that is being looked at multiple levels. So from that perspective, yes, they are looking. We are going to the field soon, so I'll have a better answer of what's actually getting fed back to the frontline workers. However, a larger issue is the growth monitoring itself. The measurement processes are so flawed on the ground that the data are just junk.
Completely agree with you.
So I don't think that should be actually used to determine whether a child is growing well or not.
At least the weight for age we can think about, but not for the weight for
Even
height.
the weighing is an
That's
issue.
why in that challenges we mentioned, the capacity building of the frontline worker is very much important.
Thank you so much, Rashmi, for the wonderful presentation. I just have one query. What I understood from the program was it was a partnership between WCD department or say ministry. So, and you said the dashboard would be available at block level. So I'm interested in knowing, will this dashboard would be only accessible to WCD staff, or it will also be accessible to health and family welfare? Because they both work differently. And I think it is important, if you find some child who are at risk and that child needs treatment, then we have to connect them with health and family welfare. Otherwise, still separate, then we won't get the impact. So maybe we can think over it.
Comes back to the same issue, cannot change the design of the program by app. So right now, there is a disconnect between how children get referred and how it's taken care of at the health department and how the community management happens. I mean, right now we don't even have guidelines for community management of acute malnutrition. So the design of the system is not there. Right now, the WCD system doesn't talk to the health system. The app is only in the WCD ministry. But it is available at the district and state and the national level also. It's not just at the block level.
My question was in the Suhara program. In terms, I have question on the demand side and the supply side. So when you mentioned in the demand side, you said the SBCC approach was extended to the whole family and not just to the mothers and children. Can you elaborate a little bit more on how the result of the family, entire household eating the eggs, did that change, or if so, how significantly? And second is, you mentioned on the supply side about each family or household getting 5 chickens. Can you elaborate a little bit more on the mortality? And you also mentioned about engaging at the systems level to create an enabling environment. If that happened, how were the results changing? Thank you.
So the first answer to multiple parts of your question is our impact evaluation is not yet done, so we cannot say that a particular intervention had an effect. So what we can look at so far is associations between different types of different components of our intervention and particular outcomes. And so the family approach, for example, separate from the mother only, we're extremely interested in looking at that, and we are beginning to see that. Some really initial findings from that is that it seems to be that for child-related behaviors, growth monitoring, kids eating eggs, exclusive breastfeeding, et cetera, the family approach is not making that big of a difference versus a mother only being reached. Whereas for maternal behaviors, so modern family planning, maternal egg consumption, ANC, et cetera, the family approach seems to be. But this is work in progress to look at it. And as far as the chicken distribution, we could talk an entire dinner about this. Try getting chickens to the mountains. It's quite exciting. Mount Everest is in Solukhumbu. That's one of our districts. And we're in that whole mountain range. So I think Helen Keller was quite used to distributing chickens in places like Dhaka or the rural villages of Bangladesh that, are slightly different. And so we have a lot of lessons learned. But to date, what we struggle with the most is chicken mortality, and there's a big issue around Newcastle disease, and we're really trying to work on because it's a little bit beyond the scope of the program to go around every month and vaccinate chickens, which is the protocol. We need the government systems to work. And so there are some things that the program can do, such as set up public-private partnerships to try to get higher quality feed available in the communities where our chickens are, as an example. But there are other things like the actual functionality of vet services that all we can do is work with our government counterparts and see how we progress over time.
Okay, thank you. All right, so we have we have to finish right at 3. So what we propose is that in your groups that you were in before, if you want to reform, that we've posited 2 questions here, and we suggest that each group take on just one of those questions. You can decide which one. And what we're looking for is some concrete suggestions. Think concretely about either how do we gain knowledge to be able to improve implementation of actions? How do we get that knowledge? And the second one is, how do we have people whose primary job is research and people whose primary job is implementation and practice? How do we get them to engage? How practically can we get them to engage in the shared space that implementation science is promising, as we've discussed it? Okay, so we'll take about 15 minutes for that. So very efficient work, and then we'll have a report out and we'll end, okay?
Up discussion and move to the share out. We have about 10 minutes left. So we want to hear what you've thought about, however nascent. All right, so just let us know first which question you addressed and then share your thoughts.
Sure. We've addressed the second question on how do researchers and implementers, both of them engage for collaborative engagement. So for us, I think the overarching theme was it's important for both parties to get into this space, knowing that we are in together with probably different motivations. So the motivation of a researcher might be different from motivation of an implementer. So it's important that we get in with that mindset, but also with the motivation to align our own reasons for working. So we've come up with a couple of ideas. One is, during the initial kickoffs phase, we sit together and then define the timelines, because the timelines for a researcher might be very different for the timelines for an implementer in terms of the ethical clearance or whatever have you. So that's one part. The second part, some of our colleagues were also mentioning is that we have, for example, our colleague from Bangladesh has been mentioning that they have workshops and learning fairs where, all policy makers, implementers, and stakeholders from across the development space come together and share their learnings. So that we found is also a very helpful tactic. Anything else? And also joint field visits as well. So, yeah.
Wonderful, thank you. Next table, does anybody want to volunteer? Or we'll just pick one.
Can you display the questions once so that we are not really off track? Yeah.
Or, can we display the questions? Sorry, real quick.
We've kind of, sorry about that, yeah. Okay, how do we gain knowledge and improve implementation? We're saying that, there are many ways of going about that, but one of our experiences is, really not look for, long, deep and, midterm and end-line evaluations, not wait for that, but have an inbuilt system of maybe process monitoring, concurrent monitoring, quick and dirty surveys to understand with the respondents, with the process people, with the implementers, how things are going on. And in a way, keep a finger on the pulse of the program. So that's where you can kind of keep on feeding back to the program and keep on making changes. So that was what we discussed. We also discussed that between the evaluation and the research partner and the program implementer, a clear-cut understanding of what each other's roles are, what the program is about, how it's evolving, what are the critical elements about it. A constant dialogue needs to happen right from the beginning, from the designing the concept of the program, and they need to keep on interacting so that there is a clarity of understanding of what's being implemented vis-a-vis what needs to be researched. And we also felt that it's not enough, people at the top level talking to each other about the program, but also people who do the actual evaluation, the survey teams, they need to understand what the program is about, what are the right questions to ask. Even the data, analytic teams, they need to understand what the data actually means to be able to feed back to the program. And also, what are the questions that the program implementers really want the answers to? And if you get the answers correctly, then they may, and sometimes we were discussing, it's not always that the program implementers don't want to hear negative. In fact, sometimes they're willing to hear the negative because they want to change and bring an impact. So I think there's a little bit of discussion between both parties involved to make it more effective. That's what we discussed. Thank you.
Yeah, so we echoed a bit what this table said about timing, and sometimes it's not that you don't have a mechanism through which to share. We addressed the second question as well. So it's not that necessarily that the existing mechanisms of meetings and sharing and things don't work. It's that there isn't quite enough time for not only just collecting this lots and lots of monitoring data, but then processing it and translating it and feeding it back. And I mean, I always say there's very few programs that build in course correction properly into a program. We also discussed, so we have a private sector person on our team, and so he said that it's really important that the questions, there's a lot more interest in questions that they have that really mean something to their business and their objectives and their bottom line. So of course, getting input from the beginning. And what did you said something at the beginning also? No, I can't remember.
Everyone sort of has their own
yeah.
expertise and include that.
So yeah, I think we talked about that more, that there's a propensity for data overload, and that there's certain pieces of information that are very important for different people and different levels of expertise. And so to engage people at different levels of the project where it's really appropriate, rather than just sort of dumping lots of monitoring data on them. Yeah, thank you.
Okay, our group also talked about the second question. We talked about a need for sharing resources and data between implementers and researchers, and we have a lot of program implementers at our table, so they talked about the fact that they have a lot of data, but they don't necessarily have any budget to analyze the data. So we also spent a lot of the time talking about how could we kind of match researchers and implementers to each other, what kind of platforms could be used for that. We talked a little bit about SUN, the Scaling Up Nutrition Network, as a possible platform. In some countries there's a government agency that coordinates multi-sectoral nutrition activities that could be a platform for getting implementers and researchers together. And then we talked a little bit about digital platforms, and that was about as far as we got.
Yeah, so for how do we gain the knowledge to improve the implementation of action, effort shouldn't be oriented towards impact evaluation, but rather the process evaluation. So based on the objective of the studies and considering the contextual factors are related to the study, the proper process evaluation should be planned before taking up the study. And in that process, what a group was discussing, the independent research organization can be involved so that it will be an unbiased and without when a government or government related organizations are involved with the impact, it may affect the or the influence the outcome of the impact what the funder is looking for. So the group is suggested that the process evaluation should be done with an independent research organization.
So thank you very much. Okay, so we'll come to a close. That was you did in both small group sessions an amazing job of generating some ideas and articulating them well. So thank you for that. I think that what we've tried to do, to just recap today, is to really call our attention to that if we want implementation to be better, then we have to decide that implementation itself is the priority, and we have to have a lens where we're focusing in specifically on implementation. We have other lenses like evaluation, impact, and process evaluation, and those can be helpful, but if we only use those lenses, we're not going to have sufficient focus on implementation. And I think one of the points that Talia, this group, mentioned right at the end, and some others did too, is that the part of the focus on implementation is allocating time to it, both as the program's running so that they can have time to improve it, but also to gain the knowledge to do it. So I think that's mostly what we've tried to do, is to give us a chance to talk about what it might look like if we really do raise implementation to that level of priorities. So now our job is to write about that, to talk about that, to find mechanisms to work together between people who are scientists and trained in that and people whose job it is to make the implementation work, and all of the other stakeholders to go out and try to do that, so that in a year from now, if we're talking about this again, we can look back and say, okay, here's some things that we were able to do to try to heighten the importance of implementation and try to make some progress on it.
And I would just like to note, as we close, this is an ongoing conversation, and the three of us are actually board members with the Society for Implementation Science and Nutrition, which is trying to stay abreast of all these exciting developments and new conversations happening in implementation science within the kind of broad sphere of nutrition, nutrition-sensitive, multi-sectoral nutrition, as well as nutrition-specific. So it's meant to be very inclusive. If you're interested in learning more about the Society and what it's doing, you can speak with any of us. We encourage you to become members. And we encourage you to become members and stay involved in this conversation, because we've seen you have fantastic contributions, and we would really love to hear more and not just not end this conversation here. So please do stay involved, and please approach us if you have any questions about the organization. Thank you.